everyone, welcome to One Awesome Autistic. I'm kind of following on with a video from last week. So last week I did ADHD in adults. I wanted to do that because I'm an adult that has ADHD. I figured seeing as I've done the information on adults, I wanted to follow it up with actually a video about ADHD in children, particularly because the symptoms can be quite different. For those that haven't seen the ADHD in adults video, I'll go over a little bit of important information. So if you have seen it, there might be a tiny bit of repetition in this one. But it's for anybody that hasn't seen that video, so you're not missing anything important. ADHD is broken down into two categories. So you have both these categories if you have ADHD, and that is, you have inattentiveness, and then you also have hyperactivity and impulsiveness. There is also a form of ADHD called Adhd, which is where you don't have the hyperactivity side of things. And this can be kind of trickier to notice or diagnose because it is not as noticeable as if you have the hyperactivity thrown in the mix. So let's talk about the main symptoms of ADHD in children. Like I said, this differs a little bit from adults. In children, symptoms usually occur before the age of 6, and they happen in more than one type of setting. So usually they will happen in school and at home rather than just in one of those settings. There is quite a long list of symptoms when it comes to children, so I'll go over just a few of the main ones, but then I'll pop a link in the description below for the NHS website, which actually lists all of the symptoms if you wanted to take a closer look at those. So some of the inattentiveness signs are constantly changing task or activity, having difficulty organising tasks, being unable to stick to tasks that are time consuming or tedious. And then some of the signs of the hyperactivity and impulsiveness is things like excessive talking, excessive physical movement, and being unable to sit still, especially in calm or still surroundings. Now, a lot of these symptoms in children do obviously seem a little bit like, well, that's just typical behaviour of what children are. Children fidget, children can talk excessively when they don't realise, but it's to a more exaggerated degree when it's in children. It might seem more obvious in a school setting when you see that child versus all the other children in the class. Also, having ADHD and having these symptoms can cause problems in a child's life, such as things like behavioural problems. There's a typical thing of, before ADHD was more known about, a lot of children with ADHD were just seen as the sort of problem children in their class with bad behavioural issues. As well as having ADHD, a lot of children tend to have other conditions alongside it. So it's quite common to also have anxiety disorder, oppositional defiant disorder, conduct disorder, depression, and autism spectrum disorder, sleep problems, or even learning difficulties. Obviously, having another condition alongside ADHD can make it a little bit harder to diagnose, but typically a health professional will pick up on the subtle differences. There's no real known cause of ADHD. There's a lot of speculation and there has been various studies, but there's nothing concrete as of yet. There does seem to be a higher chance that a child will have ADHD if family members, particularly a parent, has it as well. If you have a child that you think has ADHD, the first port of call is actually to speak to the school. See if they are noticing any of the behaviours in the classroom. If they are as well, then that might be an indicator, and then you go and talk to your GP about it. A GP can't diagnose ADHD, so you'll be referred to a specialist to see the child. This will typically be a paediatrician, a psychiatrist, or a learning difficulty specialist, and they will typically be an expert in ADHD or have quite a range of experience with it. As opposed to adults, the assessment and diagnosis process of a child with ADHD is a lot more extensive. That's probably because it's harder for a child to express or understand the way that they're feeling as opposed to an adult. There may be a physical assessment to rule out any other health implications there, a series of interviews with you and your child, and then reports from other significant people such as teachers. And this is so that they can get the most accurate diagnosis for the child. The two main treatments for ADHD is medication or therapies, and quite often it's a combination of both that works well for a lot of people, and particularly children may benefit more from having medication alongside therapy. There's a lot of different types of medications available, and it will depend on the symptoms of the child as to what medication will be recommended by the specialist or by the GP on the specialist's recommendation. Unfortunately, with medications to do with ADHD, it can be a little bit trial and error. The best medication may be the absolute perfect one, but it may not, and that can be quite difficult and distressing for children when they're then having to deal with extra side effects of tablets. But if the side effects are too distressing, then speak to the GP and a medication switch can be made. Luckily, doses tend to start off really low, so if there is any negative side effects, they'll be minimal. And therapy isn't just available for the child with ADHD. As a parent of a child with ADHD, you will be offered therapy as well, and this is to help you help your child. It's not to say that you're a bad parent or you're doing anything wrong. It is to give you the best tools possible to help your child and nurture your child as they grow and live with ADHD. It's a lot about behaviour management and also improving the relationship between parent and child as well. Having a child with ADHD can also sometimes be quite isolating and quite challenging. So there are a lot of support groups available, a lot of them in local areas as well. I'll post a link in the description below that might help with finding a local group. Also, the NHS website has a great kind of living with ADHD page, which gives a lot of tips for parents of children with ADHD and also for adults with ADHD, so I'll also pop that in the description below as well. Thank you for watching this video. I really hope it's been helpful for somebody out there. But that's it from me this time around. I'll see you guys in the next video. Bye for now.